Now we move on to our next session on holistic approach for children's health using a children's immunization app, reminders for health promotion in Zaatari refugee camp in Jordan. To present this, I invite Dr. Ziad Khatib. He's the Associate Professor Global Health at Karolinska Institute. We will take questions at the end of the presentation.
Hi, my name is Ziad Al-Khatib and immunization app where we used a holistic approach for this project. It's called the CIMA, the acronym which will be used during the presentation. This project was made in Jordan in the Zaatari camp for the Syrian refugees. I think all of you are familiar with the yellow card, and you know that this is usually, it's not easy card to use, although it's very useful and helpful. So imagine being a parent and you have to record the vaccination records of your children. Myself, now I am dealing with it with my 6 months old child, and it is already a headache. So imagine when having more than one child, and then you have to learn all the acronyms of the different vaccines, and you have to remember also each vaccine, what does it stand for, and when to go back to the clinic so the health staff can give the child the follow-up dose. And of course, when we forget what this vaccine is about, then we go to Dr. Google, especially when we are not trained in the health field as parents. And sometimes we find a level of misinformation on the internet, which can be also discouraging for us as parents. That's why we should vaccinate the children. Now, on the top of this, imagine being a refugee who you had to run away to flee your life with your children, and you don't even remember exactly what were the vaccine taken back home. And then you have to adapt to the new host society with all the healthcare system structure. And also you have to get your children vaccinated, and you have to learn them again. So the Zaatari camp was established in 2012 in the northern part of Jordan, on the close to the southern part of the borders to Syria. And it's considered the second largest camp in the world in terms of density. And it has almost plus or minus around 90,000 residents. The camp has several clinics, and they provide also vaccination to the parents. The project started with the idea that there is a need to have digitalization of the vaccination history, so parents can have the vaccine history on their smartphones, and also to provide them health promotion regarding the vaccination, which was provided from UNICEF, plus health information regarding the vaccine and what do they prevent. And also, due to COVID-19, we added a component on parenting skills, which is provided from the UNODC. These materials were already provided on for parents to support them in crisis mode or in general in the host society before COVID-19. And then there was an adaptation for the COVID-19 as UNODC response. So this app became a platform to be able to support the parents using the smartphones. In general, parents in the camp, they have smartphones, mainly Android phones, and they have access to the internet, but they don't know really what to trust. And this app came in a very good timing to match the need of the parents. The camp has kind of a semi-permanent structures, but not 100%. So the parents mainly the households are made mainly of containers, but not all roads are well established. So during winter season, for example, it's a hassle to get to the clinic. And usually with the apps, we used the traffic light system. So parents can remember immediately by opening the app and looking which color, when it's red, it means, oh, I missed this appointment for my child. If it's orange, it means, okay, I still have time. I have to check when I have to get my child to be vaccinated. And if it's green, it means it's done. The parents, they can manage the data themselves on the app, so they don't need the internet. They get reminders, 3 reminders before the appointment and 2 reminders after if they miss the appointment. Also, the reminders are integrated inside the smartphone calendar, so they don't need internet to be able to have reminders. So it doesn't come as an SMS, but as a pop-up window on their phone. The health promotion material was developed by UNICEF, and it was tested and validated by UNICEF for this context. So we only used the leaflets that was provided by UNICEF. So this project was done the first phase where we tested the app, where we enrolled around less than 1,000 children, 50% in each study arm, in the intervention, half of them in the intervention, half of them in the control study arms. Here you can see the distribution in terms of these bubbles, the locations of the households. The red is the intervention and the blue is the control study group. When we looked at the comparison between the intervention and the control study groups, there was barely any difference between them, except regarding the decision-making in the household. In the intervention group, it was mainly more likely the fathers to be the decision makers regarding vaccination. In the control group, it was the moms. And then here I share the data when they came back to the clinic. We looked at one appointment when they came back, and usually we took 7 days as the cutoff point. So we can see a slight difference here when we look at it only in terms of this table in terms of the analysis by comparing them. But I will show you later a Kaplan-Meier survival analysis where it shows better the impact of the app. And I have to add a caveat here that the parents, the children who did not come back to the clinic, we couldn't call them 100% as lost to follow-up because we tried to trace some of them and they moved outside the camp. So in Jordan, the system is very flexible with the refugees. If they would like to move outside the camp, the families, the government has no objection. And most of the Syrians, they are entrepreneurs, they open their own shops. The area there, you can see that the refugees, they have actually created a huge economy in the area because Syrians are entrepreneurs in their nature. So when parents didn't come back, we assume more likely that they moved outside the camp. We couldn't do follow-up for all of them, so therefore the data is missing because we couldn't call all of them because of lack of resources simply. Here, when we look at the impact of the app in terms of reminders, we can see that there is a risk reduction around 9% that children come back within a week time, and this is an acceptable period of time. So according to the Ministry of Health, they will not be called as defaulters. Now, the approach that we have used here, we did an inclusion for all stakeholders in this process because technology alone as a phone machine or as an app doesn't work if people don't use it. And people will not use such an app if they don't have level of trust in the entity that is providing the service. So throughout the process, we have included all stakeholders, all organizations, to inform them about this project. And also we informed community representatives as well. So then when we start, and also the staff, when they were trained, we also trained locals as well on the app. So everyone was really well informed throughout the whole process. And when parents, they ask us to do some updates, or as there are certain things they didn't like in the app, also we were fixing everything on the spot. To be able to really serve the need of the users at the end. And this process, we believe it was very useful and helpful to build the trust with the parents, especially in a setting that is for refugees, which they are very vulnerable. So also UNICEF, UNHCR, the local police were informed as well. All of them were informed, and they were on board in this project because they could see it's very useful and helpful and needed as well. And of course, the Ministry of Health and the Jordan University of Science and Technology, just. Now, when COVID-19 happened, of course, there was lockdowns in the country, as all countries in the world, and residents of the camp got affected. And here we did a study to look at the reported cases related to mental health, and we could see there was a peak happened just a few days, 2 to 3 days after the lockdown. So therefore, the need to support parents in terms of for mental health and the children became high, but the access to the camp became also limited due to the lockdowns. So here we have integrated the parenting skills material into the app, where we enrolled 1,100 children. That was done in February, March of 2021, this year. And parents also informed us that they trust the app and they can access the internet, but they don't know what to trust anymore in terms of COVID-19. So we, on the top of this information on the parenting skills from the UNODC, we also added information on COVID-19 and excuse me, and COVID-19 vaccination. So then parents are well informed about the pandemic. Now, the way to move forward, the next step would be piloting the app in Rwanda at a public clinic, and in Cameroon as well. And in Cameroon, there are HIV infected children will be included because also of the peculiarity for the immune system of children infected with HIV, that to come on time for vaccination, they are a very vulnerable group. And also in Cameroon, they requested to add COVID-19 vaccination history, so adults can also use the app. So then it becomes also more of a holistic approach for parents or adults and children. The app, in Jordan, it was done in English and in Arabic interchangeably. In Rwanda, it will be done it's already developed and it is in English, and in Kenya, Rwanda, in Cameroon, it is in English and in French. So as well, the material, we did the same for each country, depending on the official languages and what our collaborators have requested. So as a take-home message, the lesson learned that the scalability is possible, and the app is low cost, is for free, provided to the users. We did a holistic approach to everyone is included in the process. It is easy to use this app. And also we are leveraging current knowledge from UNICEF, from WHO, from UNODC. So we don't have to reinvent the wheel. The partnership model also has strengthened the local ownership for the app by the users. We did a digital transformation for the currently available information. So we did not try to invent a new system. We just tried to test if we do a digital transformation of the physical system, can this work? And it did work. We were always responsive to the community needs, which is very important, so they feel that they are heard. And also, all the time, patient was the center, or the user was the center of this whole process. Finally, I would like to acknowledge all our collaborators and donors, because without them, we couldn't really do this project. Thank you very much.
Thank you so much, Dr. Ziad. So we have a few questions from our audience. Our first question is from Lin Yun Hao. She asked, can I know more about how you advertise the app, with channels, messages, and how you promote using it?
Can you please repeat the question?
Yes. So the question is, can I know more about how you advertise the app and how you promote it?
So at the beginning, we did the advertisement by first talking to the local stakeholders and also representatives of communities, because inside the camp they have also like community leaders and representatives. And then later on through the clinics, the vaccination clinic, where we will inform the parents about the app and if they would like to be enrolled. That was in the first phase. Then after, when the COVID-19 happened, then we used to go, the staff from Monday to Thursday, it's inside the clinic. And then on Saturday, there will be household visits from community representatives, two volunteers, that they go and inform the parents about the app.
Thank you. We have a question. Was smartphone network connectivity an issue during the health promotion process?
Yes, yes and no. During the winter season, and sometimes we had an issue with the internet, so we were using a 3G bundle, so then to use like a hotspot, and we only needed the internet at the time of downloading the app. But to use the app, you don't need the internet, and to access the material inside the app, you don't need the internet. For the parents, usually also they have internet, and also sometimes there is a Wi-Fi connectivity. So in general, that was okay.
Okay, thank you. We have another question from Abhi Damrat. He's asked you, first he said, excellent initiative that will hopefully be a standard tool soon. Looking forward to how do you make sure that those who do not have smartphones or data packages are not marginalized from services?
That's a very good question. Inside the camp, almost all households have smartphones. Oh, excuse me. Sorry, all households have smartphones. The only thing that, and also all of them, they had Androids. The only thing that it happened recently during COVID-19, that the emergence of the Chinese operating system, it started to emerge for people owning the machine Huawei. So this, we didn't know exactly how many, but they couldn't use the app because the app is only developed for Android. But from my understanding, that the majority are still using an Android operating system on their phones.
So similarly, how is it a practical approach to access this app for those people who are not on a smartphone, a phone, have no internet connection, or are not familiar with the technology?
That's also a good question. The app requires smartphones naturally because you need to download it from the Google Play Store. And also, by the way, I forgot to mention in the presentation that also Google Play Store, they have the Google Play Protect, which they give you like a stamp on an app, and they have reviewed our app. It's a manual process, and it also has been verified by them as well, which is a very good sign. So the access to the app needs a smartphone, and it needs to be an Android supported so far. Also in Rwanda and in Cameroon, the majority are using Android phones. So far we are not switching to, there is no need to make a version of it for the iOS, which means on the iPhone iPhone machines.
Thank you. Mohammad Mudir Hussain asked, is the software of open sources?
Yes, it is open source, and it is also for free. The app is not made for purpose of a profit. It's for free.
Lukman Hakim asked, probably has been asked and answered before, how deep is the penetration of smartphone in Zaatari? Echoing questions by others, how do you reach parents that don't have smartphones?
In Zaatari camp, smartphones, all they have smartphones. At least we asked for each household they have how many smartphones they have, and at least there is one or two on an average, I would say. So this hasn't been an issue. And sometimes if it's one of the parent has a smartphone, let's say the mom will come with the children to the clinic, and the mom will like the idea. She will call the dad and tell the father, please come now, bring the phone or send me the smartphone. We need to install this app, or the dad will come later on, or vice versa. So in general, I would say they have been very supportive for this project because they could realize that, oh, now the vaccination is something very important, that there is a digitalization of it, and yeah, why not, let's take care of it. And because also some of them, they complain that they can lose these cards and they have to go back to the clinic and to ask for new cards, but in this case they have it on their smartphone.
Okay. How does a patient get expert vaccine service provider's opinion if needed?
The camp has staff from the Ministry of Health. The nurses are highly qualified, and they have also on a daily basis staff from the Ministry of Health, from the vaccination and surveillance team. They come and they can come and ask questions. Also during COVID-19, when there has been lockdown, there has been a hotline number that parents or anyone can call 24 hours for any questions. For the app, they also could reach out to us through a WhatsApp number, and usually within less than 12 hours, actually, someone from the Ministry of Health will call them back immediately to answer their questions.
We have one last question. Were there any issues related to data compliance, privacy, and confidentiality regulations that you had to keep in mind when engaging, especially now that you will be planning to do this in Cameroon and Rwanda?
Yeah, the project has been reviewed and approved by the Ethics Committee at the Jordan University of Science and Technology. And also we have applied to data protection policy as well during the process. And also we did comply to the local stakeholders, regulations in terms of UNICEF, UNHCR. So for Rwanda and Cameroon, also we are complying to the ethics committees for these projects, because the project starts as a study, as a pilot, and then if there is an interest to scale it, the local collaborators will excuse me, will take care of it. Yeah, back to you.
Okay, thank you so much, Dr. Ziad. I think these are all the questions we have today. And thank you for presenting this very innovative approach to immunization.